If you have pain, tingling, or numbness in your arms, wrists, hands, or fingers, chances are you have a repetitive strain injury such as carpal tunnel syndrome. It's a common condition that affects people in all kinds of work, including office workers, musicians, assembly line workers, and many others. If you're not familiar with RSI and what are the most common symptoms and types, you can watch my other video on the topic. But in this video, I'd like to have a quick word about wrist splints, also known as wrist braces. The question is, are they useful, and if so, when and for how long? RSIs such as carpal tunnel syndrome is a common cause of pain, weakness, sensory loss, and activity limitations. Currently, the most common initial treatment is to put a splint to immobilize your wrist. You usually wear a splint during nighttime for several days or weeks in the hope that your symptoms will get better. But does wearing a splint actually work? Is it a good idea to wear a splint to immobilize your wrist? Well, it turns out that there's very little evidence that splints work. Before we look at the evidence though, let's understand what's the idea behind using splints. So the idea behind splints is to keep the wrist from dropping into flexion so that it stays in a neutral position. For carpal tunnel syndrome in particular, the theory is that this can help reduce impingement of the median nerve going through the carpal tunnel. If you have carpal tunnel syndrome, chances are that your symptoms are worse at night. Doctors think that this is because your hand is more likely to bend while you sleep, but they're not entirely sure. The splint prevents this from happening, so many doctors will prescribe one without necessarily assessing the available evidence for their efficacy. So what is the available evidence, you ask? Well, to date, no placebo-controlled studies have been completed to determine whether splints are actually useful, although there's one such study underway. You can see the description of the study here. Unfortunately, the study is still underway and results should be available only by the end of 2020. Placebo-controlled studies are a way of testing a medical therapy and of telling whether they really work. These studies include two groups of people. One group receives the real treatment to be evaluated, and a second control group received a sham placebo treatment, which is specifically designed to have no real effect. Okay, so we know that there are no placebo-controlled studies available yet. But what about other studies conducted to date? What do they say? Well, a systematic review was conducted in 2012 by the School of Public Health and Preventive Medicine at Monash University to determine whether wearing a splint provided any benefits to people who suffered from carpal tunnel syndrome. A systematic review summarizes the results of available healthcare studies that were carefully designed, which are usually controlled trials. They provide a high level of evidence on the effectiveness of healthcare interventions. In this particular systematic review, the researchers found 19 studies involving 1,190 randomized participants. Some of the studies were of very low quality, so the results couldn't be trusted. For those studies that were robust enough, though, the researchers concluded that there's limited evidence that the splint worn at night is more effective than no treatment in the short term. They also said that there's insufficient evidence regarding the effectiveness and safety of one splint design or wearing regimen over others, and of splint over other non-surgical interventions for carpal tunnel syndrome. In other words, it's not even clear that wearing a splint is a safe thing to do, or whether doing something else might not be more effective. So the scientific consensus to date is that wearing splints or braces is probably not effective, and in some cases, splints could even be harmful. Why is that? A well-known anatomical physiologist named Pete Egoscue argues that braces interfere with the close interactions of your body's various structural components. Even though your wrist might be in a neutral position, you can still use your fingers to perform all sorts of movements, such as typing and writing. The brace or the splint only shifts the excess friction to another location in your arm, hand, or elbow. Egoscue says that before long, the friction is going to reignite the fire, that burning or tingling sensation that bothers you, but at a different place. Egoscue also argues that if you use wrist splints for a long period of time, you could risk increasing the severity of your symptoms. That's because your muscles become inactive, and this decreases blood circulation and sense of awareness. I personally suffered from RSI for over 2 years, and I tried wearing a wrist splint in the early days, and it did nothing to stop the symptoms. I also spoke to many people who tried wearing splints for several days or weeks, and the vast majority noted that they hadn't seen any long-term positive benefits. Now, some people said that their symptoms kept getting worse even though they were wearing a splint. So to conclude, scientific studies show that splints are, at best, ineffective to reduce RSI symptoms. In worst cases, they're a short-term solution that can potentially bring on long-term damage, particularly if worn during the day, because they only shift the excess friction to another location in your arm, hand, or elbow. Splints essentially work as a crutch. They reduce or eliminate muscle movement, but they do nothing to deal with the cause of the problem. Wearing a splint during the day can be counterproductive because your joints can become stiff and your muscles can become weak. For this and other reasons, I would not recommend the use of splints. If you've personally tried using a splint though, or you're using one right now, please share your experience with the rest of us in the comment section below. We could all benefit from sharing our honest views and experiences about wearing wrist splints. Thanks for watching, and don't forget to subscribe for more information and tips about how to get rid of RSI.